Okay, we're going to get started. I was waiting for a lucky number 100 in the participants before we started. We've had amazing participation, huge numbers of folks that have registered to be part of this. I know we'll have lots of people that join us as we go along and more folks that'll be watching us on Facebook. We're also going to be posting this on the All In Together website. So we're so thrilled to have all of you with us for this incredibly important and very timely discussion. I'm Lauren Leader. I'm the co-founder and CEO of All In Together. That's me with much more makeup on. I think we all have evidence somewhere of when we used to dress up. We founded All In Together in 2014 with a very simple but incredibly important mission, and that was to bring civic education and empowerment resources to women across America. We're going to ask that as you get to know us, because I know there are many of you joining us today who maybe have not been to All In Together programs before, to please follow us on all of the relevant socials. We are a constructive and positive and thought-provoking and motivating place on the interwebs. We work very hard to make sure that we use our social content for good, and we would love for you to follow us. I also just want to acknowledge for this, which we will discuss again in a minute, our wonderful partners at the 19th News. If you've not followed them, you should. They are launching this summer, and we're very excited to have journalist and editor-at-large Erin Haynes with us to help moderate our discussion with our incredible speakers in a little while. So just to tell you a little bit more about what this session is going to be, we are here to learn why it is so critical to advocate for survivors in this crisis and always. We're going to talk about how to do that effectively and how to make a difference on behalf of those who may not be able to speak up or speak out. And we're going to talk about ways, very specific and tangible ways that we need government to respond to the surge in violence against women, which we're seeing as part of the COVID crisis, but unfortunately is also part of the status quo in the United States and around the world. And then we're going to have an amazing panel discussion with some incredible speakers, including our good friend, United States Senator Tina Smith from the great state of Minnesota, who will be joining us in a little while, as well as incredible advocate and leader, Paige Fink, who runs the largest shelter for survivors in Texas, and Ebony, who will be with us to talk to us about her incredible work at Reliance, which is a major national advocacy organization for domestic violence. We're also going to have an opportunity for Q&A, and you'll see the Q&A box, many of you who know Zoom well. We won't be able to get to the Q&A throughout, but please feel free to leave questions at any time. My team's going to be feeding them to us and to our speakers, and we do want to try to address questions as we go along. So thank you all for joining us. We're excited to have you. Oops, I did something wrong. Technical difficulties. So really briefly, All In Together's mission is to encourage, equip, educate, and empower voting age American women with the nonpartisan civic education they need to realize their full potential as leaders. It's a very simple mission in a way. We need women shaping public policy at the local, state, and federal level. We need the voices of women to pervade every aspect of our political process and our democracy. And that need is urgent, and it has never been more urgent than it is today. We have in-person programs when when the world is having in-person programs, and we have two amazing programs, our Fellows program and our Emerging Leaders program, which you will hear more about. And now we are continuing our programming through webinars and virtual town halls. Let me tell you a little bit about why we do what we do. And I think many of you are on this call because you believe in this very mission. But the reality is, for any nation to really fulfill the full promise of gender equity, women must have equality in three critical realms: the personal, the professional, and the political. Women's lives must be free from violence. We must have the personal freedoms to fulfill our full potential as humans, to fulfill our hopes and dreams. We must have the work opportunities, the professional opportunities to support ourselves and our families, unfettered access to any role or occupation that we so choose. and we must have equal political power. You know, for many years, I think in America, we've undervalued the importance of political power for women. We've focused more on getting ahead at work and on doing well for our families and getting educated. But now more than ever, we're seeing that the political power of women has such a huge impact on our ability to fulfill the rest of these two. We need public policy to reflect our needs. We need public policy to create an environment of safety and security for women, economic opportunities, and more. And that's why we focus so much on women's political power and participation. Look, women are the majority. We are the 51%. Women have outvoted men in every election in the United States back to 1980. And that was true in the 2016 election. It's been true in every election. And yet, when you look across the landscape of women's political power, our political power is not reflective of what these numbers really mean. In fact, over the last number of years, the World Economic Forum has looked at the political power and equity of women in nations around the world. When we found it all in together in 2014, the United States was 54th in the world for the political empowerment of women. Today, we're at 86th, which is a horrendous reality. And that is even despite amazing gains in the 2018 elections of women in elected office at the state and the federal level. Because even though, yes, 2018 was, by all accounts, an extraordinary year of the woman, we saw record numbers of women running for office up and down the ballot and winning up and down the ballot. The fact is, women remain less than 30%. Less than 30%, 25% of the Senate and 23% of the House of Representatives at the federal level. We are not represented in the halls of power equal to our numbers. And in fact, at the state level, it's equally true. Only 2 United States or territories have reached 50% women in their legislature, and that is Nevada and Guam. Overall, women are only 29% of state legislatures. And so when you look at what that means in terms of the priorities that government at all levels focuses on, you see that in fact the underrepresented representation of women has a real impact on what legislatures do on behalf of women, and in many cases don't do. Many of you have been reading the horrendous stories that have been luckily very broadly reported in an array of journalistic platforms, from the New York Times to Huffington Post and elsewhere, about the profound and troubling surge in violence against women during the COVID crisis. In good times, in normal times, 1 in 3 American women faces violence. Now, in the time of social distancing and sheltering in place, those numbers have exploded. And we're going to hear more from our advocates and our colleagues who are working on the ground every day with survivors on the unique dynamics of what's been happening in this moment. It's not just in the United States. The United Nations has called out a massive global surge in violence against women. And it's not hard to understand why. You know, women who were in potentially abusive situations with an additional stress, economic and social stress of being sheltered in place, can trigger new violence in the home. Women may be facing greater barriers to leaving abusers. And in fact, I think you'll hear from Paige Fink about some of her concerns that in fact she's not hearing from women as much as she would like to be right now. And that may be because it's harder to get to a phone in private. It's harder to leave the home, to reach out to services. And that the shelter in place, because of the economic impact, that women may have even fewer options economically when it comes to potentially leaving abusers. All of these issues are there in normal times, and they are profoundly exacerbated in this time. And in addition to all of that, the service providers have their own challenges. You know, obviously nonprofits facing challenges, you know, not just to their operations, but to their financial support. And so it is, in a sense, the COVID crisis, a perfect storm when it comes to this terrible issue. One of the important and critical issues we want to hit on today is, what do we need? What's the solution? Well, we have been getting lots of input from the advocacy organizations around the country, that work on these issues. And there are a number of critical time-sensitive requests. And our colleagues on the panel will talk more about this, as will Senator Smith. A huge majority of the programs that serve women on the ground in communities across America were already facing budget shortfalls before the COVID crisis. They need significant emergency funds in order to not only meet the demand that they had before, but now meet the increasing demand in this crisis. You know, it's easy to sort of think about these things in a sense, it becomes almost anonymous in numbers. You know, and I think that's true of a lot of the dimensions of this crisis. You know, we hear the numbers of people who have died, the people who are ill, and the numbers are hard to process and they're hard to humanize because they're so big. But, you know, when you think about the statistics on domestic violence, 1 in 3 women in normal times, that means that every one of us knows somebody, is connected to someone in our community, or may ourselves have experienced violence at the hand of a partner, at the hand of another. And that, the personal nature of this, women cannot achieve our full and equal place in our society unless we are free from violence. It is such a fundamental issue of safety and security. So obviously, because so much of the support and resources for survivors happens at the state and federal level, government engagement, civic participation is critical. In fact, we really need survivors to speak up and stand up and participate in our political process, because that is how we ensure that the laws at every level of government reflect the needs of these women. At All In Together, we have been working on this for the last 3 years. In fact, we've trained over 1,000 survivors across the country on civic leadership, and we're so proud that so many of our alums have gone on to make extraordinary impact in their communities. One of our fellows who changed, and speaking of Minnesota, one of our fellows, Elizabeth Ralph, who managed to single-handedly pass a unanimous bill in the Minnesota State House, changing the reporting lines for assault on the job in the police, in the police services in the state of Minnesota. She was an average citizen who experienced a terrible attack at work and stood up and spoke out and changed the laws in her community. That is what we need. We need survivors and the advocates who care about them to be participating politically, to vote, to advocate, and to engage. But there is also no question that survivors do have some unique needs when it comes to civic engagement. Well, 39 states do have programs that enable voters to register confidentially. It keeps their addresses confidential because some survivors worry that if their address becomes public record through voter registration, that could put them at physical risk to their abusers. So on a positive note, 39 states now do offer confidentiality programs for voters. I'd like to see it be all 50. And it's important that the states that have not done this address this. And this is an important issue that we can address with our own states to make sure that survivors can vote safely and that they can register to vote safely. The All In Together voter guides, which I'm going to point to you in a minute, can tell you more about whether or not your state has that. So what's happening now? Survivor advocacy organizations need more money. Money is fundamental. And as I said, because so many of these organizations faced significant budget shortfalls even before this, the need has never been greater. So I'll let Ebony Tucker talk more about the details of this, but across the board, organizations like Reliance and others are asking for about $100 million in emergency funding for sexual assault services programs. They are looking for matching funds for the Violence Against Women Act, and ensuring that women who have been left out of some other legislation, immigrant survivors, undocumented survivors, and other vulnerable communities are getting the support and the resources that they need. I mean, we don't have time to go into every single dimension of this, but you can imagine, we already, even before this crisis, in states that did not have protections for explicit protections for undocumented workers. You can imagine that for undocumented folks, the fear of being deported if you come forward looking for support in an abuse situation is very real and has kept many undocumented women from reporting their abuse. So the lists of issues are complex and long, but at the end of the day, these organizations, these invaluable institutions like the Family Place and Reliance, they need the funding in order to deliver the services that are now being at an even greater demand than ever before. So before we turn it over to our panel, I want to talk a little bit about what we can do and how we can do it. Because the reality is that every American has this extraordinary ability to make change. We know that the First Amendment enshrines the right to free speech and freedom of religion, but it also enshrines something just as sacred, and that is the right to petition our grievances. This is a constitutional right that we all have, and it means that our elected officials, it is in fact their job to respond to the grievances and the issues of their own constituents. Now, historically, women have done less of this, have stood up less when it came to advocating, writing letters to their electeds, making phone calls to their electeds, getting to know their elected officials in order to build relationships with their office and have a direct line of communication in order to advocate on issues that matter to them. But it's not too late. We can do it now. And part of the mission of All In Together has been to motivate and mobilize women to do this. And we've seen an incredible surge in civic participation of women who've gone through our trainings like this. So look, by contacting your representatives, you ensure that they understand fundamentally what the needs of survivors, what your needs, what the needs of your community really are. That is how laws are written. Laws are written because citizens speak to their elected officials and tell them what they need. It's really that simple. And so the importance of your calls and emails and letters to your electeds is essential. Now, obviously, in normal times, we would advocate that people also make in-person appointments to go see their elected officials in their towns, in their states, et cetera. Right now, that's not happening. But letters and emails are just as important and effective. So really quick, what's so important is you got to know who represents you. You need to know who to reach out to. And on the All In Together website, aitogether.org, we have an amazing action center. You can go look state by state at who your own representatives are at the state and the federal level. We also have these amazing voter guides that have incredible information about the upcoming election, about how to register, about a whole range of resources, which I really encourage you to check out. And then by clicking through, you can also directly write to your federal representative, to your senator, and to your members of Congress. Now, don't feel bad because 70% of Americans don't actually know who their elected officials are. Most Americans don't know, but it's an easy thing to find out, and we try to make it easy for you so that you can reach out to them. Now, one thing that comes up all the time is people will say, I live in Ohio, but I really want Mitch McConnell to listen to me. I'm going to write a letter to Mitch McConnell, who's the senator from Kentucky. He's also obviously the Senate Majority Leader. We really encourage you to write to your own legislators, not to spend your time sending letters or emails or phone calls to people who do not represent you. And the simple reason is that elected officials' job is to reflect the interests of their own constituents. And in many cases, they may not even respond or record your call or letter if you are not in their district. So what can you ask them to do? You can ask them to do a few things, but this is really all you can ask them to do. You can ask them to sponsor or write or exit a bill. You can ask them to vote a certain way. You can ask them to put out a statement, and we're going to actually talk about a good example of this in a little while because Senator Smith signed on to a very important statement advocating for increased funding and support for frontline domestic violence service organizations. We'll talk about that in a minute, and they can introduce a new bill. You need to explain that you are a constituent in their district, and your ability to share your personal experience is everything. We're not going to include it here, but there's actually data that shows that what is most influential in shaping the decision making of an elected official is the personal stories and experiences of people who live in their own districts. It shapes everything they do. If you ever get bored late at night, turn on C-SPAN. You can watch members of Congress on the floor making statements, talking about the issues that they're advocating for. And what you will hear over and over again is that they are telling stories. They're talking about the people that they represent and how what they do or the decisions they make will affect their lives. You know, it's hard to think of many issues that are more personal than violence against women. That ability to communicate what survivors need is so critical. After this program, we will be sharing with you all of the resources that are in this webinar and more, so that you have everything that you need to move forward. But in here is a really terrific example of a simple way to write a letter, make an ask to an elected official about an issue like this that matters to you. I'm asking you, Senator Tina Smith, to vote in favor of additional funding for domestic violence support services in the upcoming relief bills. This issue is important to me because as a survivor and as a leader in my community, I know that our frontline organizations are stretched thin, that the needs are great, and that the funding is low. This issue is important in your district because if women are not safe, then no one is safe, because when families thrive, when women thrive, families thrive. And this impact is evidenced by, et cetera. So you get the idea. And this is meant to make it really easy for you. You can write it however you want, whether you're a good writer or you think you're not, it doesn't matter. Make it personal, make it clear, make it simple, make it direct. So you can do this by email. We really recommend that in any circumstances over snail mail. It's very complicated to get hard, paper mail through to state houses or to your federal representative for a whole bunch of reasons, but that's especially true now. So, emails are really powerful. Phone calls are as well, and we'll be happy to share back after this. We were limited on time, but we'll share back with you some resources for making an effective phone call. So anyway, critical piece of support here. Oh, let's see. So I believe we may have with us already, is Senator Smith on yet? I think we might still be waiting for her. So since we're waiting for the senator, I'm going to take a second to introduce our other amazing speakers. And I think I totally massacred Paige's last name earlier, so I'm really sorry, Paige. I'll get it right. But I'm going to invite our other speakers to join, and then when Senator Smith hops on, we'll take a pause to hear from her. So first, I'd like to introduce Erin Haynes, who's the editor-at-large at the 19th News. As I said before, Senator Smith, you are here. Great. You have amazing timing, Senator. Can you hear us? It's so great to see you. Thank you so much for being here.
Of course, can you hear me?
We hear you perfectly. You have amazing timing. And I was just introducing Erin Haynes of the 19th News, who is going to speak with you after your remarks. And I was just saying, I'm sure you've heard about the 19th. It's the coolest thing going in the news business today. It is a new nonprofit news platform put together by an amazing group of women journalists from Austin, who are going to bring a whole new perspective, I would say a full picture to news. They're partnered with the Washington Post and will be up and running in a few months. So this is our second time partnering with the 19th, and they're awesome. So Senator Smith, I'm going to let you take it away and speak. I'm going to take your picture off the screen so we can see you more fully. And just really briefly, I didn't get a chance to introduce you. I think most of our listeners know who you are, but Senator Smith has been just an amazing friend to All In Together for many years. We do a lot of programs in her beloved home state. She happens to have, I think, I think that the Minneapolis-St. Paul area might be one of the most politically fired up places in America for women. They have an incredible track record of political engagement and participation, and a lot of amazing direct service organizations that serve survivors that we've partnered with for many years. It's also so many interesting things in politics in your state. You also have the only Native American lieutenant governor in the United States, Lieutenant Governor Peggy Flanagan, who's also a good friend of ours. But Senator Smith, your work has been so powerful on behalf of women and on behalf of survivors, and we're grateful to have you, so I will turn it over to you.
Well, great. Thank you. Great. I am really happy to be joining you from my dining room this afternoon. I feel as if, as we all are, those of us who are working from home know that it is a little bit, you never quite know what to expect. So I feel I should warn you all that I'm here by myself today, and I guess there's probably a 40% chance that the dog starts to bark because he wants to come inside. So bear with me.
It just makes it more real, Senator.
Exactly.
If my kids don't come in, it's a miracle.
That's exactly right. You know, I want to just start, I think, by thanking All In Together for organizing this. And, you know, I love what you were saying at the beginning about how, I love the way that you approach these issues from a nonpartisan viewpoint. And because this gets to something that I believe so strongly, which is that most people in this country, most women in this country don't wake up in the morning and say, I'm a mom and I'm a Republican, or I'm a teacher and I'm a Democrat. We wake up trying to figure out how to make our lives and our families work. And that is fundamental to the way that we approach our role in our family, our role in our communities, the way we think about taking care of our children if we have children, or parents if we have parents. And I think if we were more in touch with that, both as political leaders like I am, but also as advocates, we would be more effective. So I think about it every single day. And I'm thinking about it especially right now as my state and our country is facing this really unprecedented challenge. Certainly it is first and foremost in my mind a public health challenge of unprecedented proportions, but increasingly it is an economic challenge, a challenge that I think we will see is the greatest that we faced since the Great Depression. And I know in Minnesota, we think as of today, roughly 1 in 5 people have lost their jobs. And in my state and in many states around the country, we are also sending a strong message as we fight this pandemic. We're giving people advice that our grandmothers used to give, which is to stay home. You're going to be safer if you're home. You're going to be less likely to get sick if you stay home. You need to stay home. And yet every time I hear that message, I think about women and children and men. I think about people for whom staying at home is not a safe thing for them to do. And in fact, it is a scary place for them to be. I had a chance earlier this week, I think it was, I don't know if you all are finding this too, but the days sort of bleed into one another, and it's harder and harder to kind of keep track of exactly what happened when. But I had a chance to be on a call with a large group of Minnesota nonprofits and advocates for domestic violence, sexual violence, human trafficking. And they were all deeply in touch with this reality that for many women and children, being at home is not a safe place. In the Star Tribune today, there was an article about how we're seeing a decline in reports of child abuse, which is deeply concerning, because it seems likely that that is being driven not by a decline in child abuse, but by a decline in reporting, as children aren't going into their schools and being connected with their teachers and other adults outside of their home life. So I think the reality of the situation we're in is that this virus is not affecting everybody equally. It is particularly painful and particularly dangerous for people whose lives were already filled with risk to begin with. That might be not being safe at home. It might be economic instability. It might be housing instability. It might be childcare instability. this virus is particularly affecting those folks. And so the first thing for us to all do together is just to acknowledge that and to remember it and to own it. And I of course, don't need to tell that to all of you, because this is the life and the work that you are doing every single day. And so now that work is even more and more important. As I am thinking about what we can do at the federal level and at the state level, what the government can do, what the public sector can do, I'm thinking about a variety of things just right now, urgently. One is to make sure that the support for service providing nonprofits through the PPP program that was in the Big CARES Act, that continues, that those nonprofits have the opportunity, continued opportunity to provide that service. Assessing how we can provide services telephonically when that is the safest and the best way to accomplish that. Assessing and then driving home the issue that, especially right now when we're talking about access to healthcare, we must include access to mental health care, access to substance abuse disorder care, which is already which is usually hard and at risk to begin with, but especially now. And looking for ways in which we can address the issues of domestic violence and sexual assault, people being safe in their homes, especially in these CARES package. Of course, I have to acknowledge that we're doing this in a year where we have not even been able to pass the reauthorization of the Violence Against Women Act, which it was organized as a way of us taking care of the survivors of sexual violence and understanding that this is that in and of itself is a public health crisis. Now, the thing that gives me optimism as we head into the panel part of this conversation and this question and answer, which I'm really looking forward to, is that we are so blessed with so many strong advocacy organizations, and we also I see so many women and men every day who are, because everything in their lives have been turned upside down, they're starting to ask themselves, what can I do? How can I make a contribution? How can I help? What do I need to do differently in my life because of what's happening in the world? And that gives me a lot of optimism, because that is the energy for the activism and the outreach and the engagement that we're going to need so dramatically in the today, but also in the coming weeks and months. I'll just close with this. Way before I ever imagined that I would be in the United States Senate, I was a grassroots organizer myself. I was the mom with my kids in a stroller going door to door in a local, very, very local political campaign, organizing around issues that I cared a lot about. So my roots, that's where my roots are. And that is where I always come home to when I'm trying to figure out what we can do to help people who are really, really needing their community to surround them with love and support right now, which is certainly the case. So thank you so much. It's great to be with you.
Thank you, Senator. We're so glad, and we're glad that you can stay on. And I just want to introduce our panel and turn it over to Erin to delve a little deeper. And I know we'd love to hear also a little bit more, Senator, about the letter that I know you signed on to, which I referenced earlier. I don't know if you've gotten on around with your colleagues around more funding. So I just want to briefly introduce, I introduced Erin Haynes, for our dear friend from the 19th News, who's going to take over for me for this conversation. But I also want to introduce Paige Flink, whose last name I massacred earlier, even though I've known her for a really long time, so don't be mad at me, Paige. But Paige is one of the most extraordinary leaders and activists in Texas and around the country. She runs this magical, incredible organization called the Family Place in Dallas. The very first program that All In Together ran for survivors, we ran actually on site at the Family Place for women who were living there. Some of them brought their babies. It was just one of the most amazing and unforgettable experiences of my life. And we've been very grateful to Paige for her leadership and her support. And then Ebony Tucker, who's the executive director of Reliance, who's been an invaluable resource to us as we've helped bring advocacy training on this issue to women around the country. We're thrilled to have you, Ebony, with the awesome virtual background. Well done. And so with that, I'm gonna turn it over to you, Erin, to take the conversation to the next level. And just for the folks that are on the call, we will welcome questions. And so you're welcome to put them into the Q&A, and our team will moderate the questions and share them with Erin at the appropriate time. Thank you.
Well, thank you so much, Lauren, and thank you for all in together for pulling this really, really important conversation together. You know, at the 19th, we recognize that whether women ever get sick or not, we are the ones that are going to be disproportionately impacted by and responding to this pandemic. And so, you know, with that in mind, our coverage has pivoted largely from the election to how the coronavirus is affecting women. So we encourage people to subscribe to our newsletter, which is publishing now until our solo site launches this summer, which is going to be free for all to consume and republish. But in the meantime, I'm really looking forward to having this conversation with you, Senator Smith, because, you know, we are seeing women really at the forefront of this response, whether that's governors, mayors, or people in Congress like yourself. So I want to start by bringing up that letter that Lauren referenced that you are a signatory on. Can you talk just a little bit about some of the priorities that you and your colleagues are raising for this fourth round of funding and support for folks during coronavirus, specifically related to domestic violence?
Sure. Well, so, you know, last week I joined with some bipartisan letters that's requesting additional funding and assistance for domestic and sexual assault violence programs through the Department of Health and Human Services. I think that that's just so important right now. But, you know, I've also just heard so much from advocates as well about how that you know, you've got these amazing social service organizations, nonprofits that are trying to meet federal grant requirements and trying to adjust their business, I use that term, but, you know, adjust their organizations to the challenges that they face. And it's really incredibly difficult. So I have also sent a letter urging the Department of Justice's Office of Violence Against Women to provide the flexibility that I believe that these nonprofit organizations are really going to need right now on grant requirements and providing, and also giving them some additional resources. Because I'm hearing from my organizations here in Minnesota that they, you know, many of them rely on grants that assume that they're going to be providing services, but they're seeing this sort of horrible simultaneous decline in people who are coming to them for services at the same time that they know that there is a dramatic uptick in need for those services as people are just staying home. They don't quite know how to access telehealth services or telephonic counseling. They just don't know what to do. And in fact, they might even think that those services aren't even available right now. So another thing that I've been doing is just trying to get the word out that there is help, that there are places that you can go and make sure that people know where to go, whether, you know, what it is that you're really needing and seeking.
Yeah, thank you so much for that information. And, you know, you mentioned the challenge with even getting the Violence Against Women Act passed in Congress. I'm wondering what the response has been, both from your colleagues and from the administration, about some of the issues that you're raising.
Well, I think in this time of, this is the challenge that we always have, right? We're facing a challenge that is kind of system-wide, it is community-wide, and it is in those times that we specifically need to remind people of those that are often just invisible and aren't seen. And I think, to me, that is so much women who are experiencing domestic violence at home. It is especially women of color and Native women who are not just not seen in a time when people are so focused on the big picture. So a lot of what I'm trying to do in Washington, and this is where advocacy comes in, right, is to make sure that those voices are heard, that those women are seen, because that's the step that's required in order to get people to then take action, which is what we need.
Absolutely. And speaking of invisible populations and women who may be left out of this conversation in this moment, I mean, you represent a state that does have a significant rural population as well. And you mentioned the telehealth issue, you know, broadband access, and folks, you know, who may be in rural areas who don't necessarily have access to telehealth. Can you talk about maybe some of the challenges for rural women around domestic violence as well, and what you're hearing about that and what you're concerned about?
Well, it is deeply worrying, the challenges that women in rural small towns and rural areas are facing, and the children that are with them and that rely on them as well. And we know that already there is a shortage of shelter beds and shortage of ways for women to get to that shelter. We are seeing kind of a shutdown also of transportation options for women, which is incredibly difficult. In Minnesota, you probably think of rural areas, also small towns and rural areas, as being predominantly white, and that is true, but we also have really significant immigrant communities in places like Worthington, Minnesota, and Wilmer, Minnesota. And so it's especially important that women in those communities, many of them are many of them are Somali women, that they have access to access to culturally specific and competent outreach, because that's what's going to matter for them in terms of them being able to get the help that they need. And one other thing that I really was just sort of hit me over the head, earlier this week, I was doing a discussion with urban indigenous people and advocates, and hearing about some of the challenges. You talk about broadband and not being connected. Well, if you are a poor Native woman living in, around Little Earth and Minneapolis, you don't have broadband in your apartment. What you do is you go to the cafe or the library or some other public place to get access to broadband and health. And so you are just as cut off as if you were in a farmhouse in the middle of a rural area in western Minnesota.
Yeah. Well, I want to go ahead and bring Paige and Ebony into this conversation, because so many of the issues that you are raising are issues that both of these women are on the front lines dealing with every day, even before we had ever heard of a thing called coronavirus. And certainly this pandemic has shifted the way that you are addressing these issues, but you are certainly, neither one of you are new to trying to confront the challenges of addressing domestic violence in this country. So if I could just start by asking Paige and Ebony to just briefly summarize how your work has changed in the midst of this crisis, and what your greatest challenges are as you continue to try to serve your communities and address the domestic violence threat where you are.
So I'll go first. Hi, I'm Paige Franken. I'm so happy to be here. It has changed a lot for us, because we have to worry about the exposure that the person who's coming into our shelter has had, and where's she been, and what her symptoms might be. Where we ordinarily would just take someone no matter what. First of all, we have to say, do you have a temperature? Are you sick? Where have you been? We still take them in, but then we're not able to provide as good trauma-informed care as we ordinarily would, because we usher them right into a bedroom before they have a time to interact with anyone, so we can be sure that they aren't infected. And so that's so different from the type of open arms treatment that we've had for women coming into the shelter. We are doing telehealth, and we're using video and phone conversations. And that has actually been pretty successful for us in a surprising way, because people still might sneak out and go to the grocery store and be able to talk on the phone, where they sometimes weren't able to drive away from the house if they were still living with their abusive partner. And so that has been challenging for us, but also just knowing that what they're experiencing is tripled because they are so confined and they're not able to leave it's scary for all of us when we answer a hotline call. It just makes it really more challenging.
Mm-hmm.
Yeah, I mean,
Ebony.
thank you. Yeah, I completely agree with those pieces. I mean, for our work, it definitely is more about the policy advocacy and the awareness part, trying to make sure that we're meeting the needs that service providers are requesting. And that has so completely changed. I think it's really interesting that Senator Smith just mentioned the work on the Violence Against Women Act. And I did policy in DC for quite a while and have been working on that the last few years. And then all of a sudden, those needs are shifting entirely. The folks who are already a part of marginalized populations, in rural areas, their suffering and what's happening has been compounded. I think that, rape crisis centers are often working on very shoestring budgets, relying on volunteers to do a lot of that work. So now trying to figure out how they're going to be able to meet needs in a completely new environment that's requiring much more of a sophisticated technological infrastructure, what all of that's going to look like, how to do this remotely and still comply with state guidelines around COVID has been, I know, such a challenging experience for them. And our work, I think, has shifted because what we're doing now is trying to figure out what their needs are while they are completely overworked and underfunded and trying to manage these things, to really use their time. And they've been very gracious with that, to help us figure out what their needs are, what we can meet through emergency funding, and then advocating for that. I think most of our work is always about just awareness on sexual assault generally, and now we've moved into this phase of helping people to try to understand what this really enhanced need is right now, and hopefully getting the word out for our local partners.
Yeah. Yeah, this is really such great information coming from all of you. And I just want to encourage folks who are here with us for the conversation to submit your questions for our panelists. I'm going to take one now from Sarah Super, who says, I'm working on legislation in Minnesota to eliminate the criminal statute of limitations for felony sex crimes, allowing survivors to report their experiences whenever, if ever, they want to. Unfortunately, legislative efforts on behalf of survivors such as mine have been put on the back burner as need for emergency efforts is on the forefront. How do you think legislators can address both the short-term emergency needs while also thinking long-term? Or how do the efforts that have been derailed by COVID-19 get back into the spotlight?
Yeah, well, thank you, Sarah, for that question. And I've been thinking about that a lot as well. You have I mean, the obvious challenge is that you have legislatures, including the United States Congress, that literally aren't meeting. And so the coming together to deal with anything other than the emergency right in front of us is just challenged by logistics as well as just sort of the mind space of legislators. So, what do we do about this? One is that we have to continue to do the advocacy that clearly you are doing. And I think that is just, we have to continue to do that. What I've been trying to do in all of my conversations with advocates on whatever issue it is that we're talking about related to COVID, because it seems as if everything we're doing is related to COVID, is asking the question of how do we build back better? Okay, so, typically in a natural disaster, there's a disaster, an earthquake or a tornado, and the federal government comes in and it says, I'm going to help you build back to where you were. But there are so many issues, so many systemic issues in our society right now that lead to inequity, lead to injustice, lead to an economy that doesn't work for everyone. We need to be asking at every moment, including moments around the health and safety of women, how do we build back better? And that is the way that I would think about bringing in that question that you were raising about how can we honor and protect survivors in the criminal justice system, even if their experience isn't directly related to COVID. It is hard sometimes to get people to think about it in those terms, but I just believe so strongly that is what we need to do. And that's what we did in the Great Depression in many ways. We built back an economy that was better, that was more fair, that was more just. Because we were able to figure out how to ask that question. And that is a question we need to ask in healthcare, in women's health and safety, in our childcare systems, in our housing systems. It's the right question in so many areas.
Mm-hmm. Thank you so much, Senator Smith, for that. And you raised an important point that I want to ask Ebony about. And that is, when we talk about building back better, a lot of being able to make the case for how to do that and where to do that and why to do that is around data collection. And so I'm wondering, Ebony, if maybe you can speak to the importance of data collection around domestic violence in this moment, and whether that is something that folks need to be thinking about, and what kind of data we could be collecting to help folks understand the scope of the issue and the response that's going to be needed moving forward.
Yeah, I think that's such an important point. One of the things that always happens, I think, in the field, I think this is true for domestic violence, sexual assault, trafficking, and stalking, is that there are funding restrictions always around spending your time on things that aren't direct service. Plus, it utilizes a lot of resources that, organizations with very sparse funding don't always have. So it's one of those things where this is such an important piece to help add resources and to meet the need, but it's also hard to make sure that it happens appropriately because of the lack of need. So I think one of the things is that in some of the funding that we're advocating for, we're hoping that there could be room for that. That I think is such a huge piece of being able to show people what is actually happening. I know that we have worked with the National Alliance to End Sexual Violence. They have been surveying rape crisis centers and have provided us with some really important feedback, but we are going to keep needing, I think, these continual snippets or snapshots of what information is in a more coordinated way. So I think even though I don't want to say everything is about funding, funding is such a big part of it.
Yeah.
In order to be able to have the time to do that, they're just going to need more hands on deck. And I think right now with the loss of volunteers, that's also made so much of the work difficult because volunteers are adhering to stay-at-home orders. There's not as much help, and so there's even a deficit from what the average need is, and in some places the need is increasing, so they're at even a larger risk for not being able to meet that need. And when you put data collection on top of that, it's difficult, but we do recognize the importance.
Okay, thank you for that. Paige, I want to bring you into this because we've got a question from Lizette Gallegos, who is asking, is there any challenge that advocates should be aware of? As an advocate, I sometimes don't feel comfortable calling so many times since they are not coming into the office. I feel like this is a really good chance, Paige, for you to kind of talk more about the drop-off and silence that you've seen in trying to do your work at this time.
Yeah, I really appreciate that question because we were having this conversation yesterday. There were 5 women who had shelter beds held and they had 2 and 3 and 4 kids with them, and none of them showed up in one day. And so our concern was, should we talk to her, try to find her? We always get a safe number when someone calls on the hotline. So we're changing our conversation when we do the hotline call to say, if you are not available, if you don't show up, we've got this room held for you. We'll hold it till tomorrow till 7 o'clock. But if you're not coming, will you call us? Because we'll be concerned that you're not here. Or if you don't come, are you safe enough at the phone number you gave us for us to contact you back? So setting it up in advance of the phone call to say, we're concerned about you, you matter. We're going to try to find you if that's okay with you. So getting permission at the beginning. And then I think as far as people who aren't coming, it's okay to do occasional check-ins. After a while, if they're 2 or 3 times, I think that's enough. But if it's spaced out in enough time, and again, it all really begins at the start when you have said, what is the safe number for you? Or is there a family member that we can contact? That's another way that we sometimes reach out to find people. So I would suggest that would be another thing that an advocate could do.
Paige, that is such excellent guidance. Thank you so much. I'm going to take another question here. This is an anonymous question asking, how, if at all, are your organizations and or the government working with corporations to try to further these initiatives? How are we able to better connect these nonprofits with corporate leaders to help with funding, volunteering, and advocacy?
Yeah. So I can shed some light there. Reliance does quite a bit of corporate work as a part of our organization. So we started Reliance Business to really address some of these issues, to talk with corporations about corporate responsibility, engaging with nonprofits better. And so hopefully there's some useful information for folks on the website around that. But I would say, I think that there are a lot of corporations now that are actually interested more in doing this work, in understanding how sexual violence advocacy works, understanding trauma-informed ways to communicate with survivors, and also how they can be a part of the solution. And I think, at least in my experience, we haven't necessarily, as a field, been in the position to reach out to corporations about that work, but I think it's okay to do that now, to reach out directly and engage and see what that interest is. I think that they can be such a valuable part of the work that's happening.
I'll just jump in for one quick second, because part of why I think we got that question is All In Together works so much with big corporations, and I know we have a lot of folks on this call who came to us through the women's networks and their firms because they partner with us. And I would just say, you know, this is where the power of individual employees, sometimes advocacy is also to your employer about why this is an important issue that the company needs to step up for. You know, corporate philanthropy is a hugely important piece of this picture, but on issues that are very complicated like this one, it's not always the first priority for the folks that run the corporate foundations and run the corporate philanthropy. But I've seen many times companies really pivot their giving strategy because a group of concerned employees step forward to say, you know what, the Women's Network believes this is an important issue at this time. We'd like you to support us, you know, by putting some money towards this, or help us support a local organization that we'd like to get engaged with. And that can be really, really powerful and important. So I definitely encourage folks to, you know, talk to their employers. And there are some companies that have been very out in front on supporting these issues. I know, Paige, you do get funding for the family place from local companies in Dallas. So they'll do it, but sometimes it needs a little push from women employees. Again, the leadership of a lot of our companies is male too. So we have to remember they don't always think of the issues that are top of mind for us.
You know, we recently at the Family Place launched a training program called Work Strong, which was developed by Women Helping Women in Cincinnati, where you actually go in through the Human Resources Department and try to talk about gender-based violence and do training of employees, which is another way to do advocacy work, because during those presentations we can talk about how they can help. And so I think those are all valuable opportunities, because people care and they know that this is something that comes to the workplace: sexual violence and intimate partner violence, both.
Mm-hmm.
Thank you for that. We have a question from Alice, and this one probably is best for you to answer, Senator Smith. There are currently 2 versions of the Violence Against Women Act under consideration in the Senate, and progress towards reauthorization is at a standstill, as you mentioned. How can we break through the logjam and pass this vital legislation?
Well, the logjam is just deeply frustrating to many of us who work on women's issues and are, you know, advocating for women every day. And I think that the logjam is, you know, part of the challenge is that while we are waiting for the Violence Against Women Act to be reauthorized, you hear a lot of people who are saying, don't worry about it, because there's still a lot of funding that's flowing and it's not really having that big of an impact. And so they're basically saying it's not that big of a deal. So I think the first thing that we could do is to really help people understand why it is so vital, why it is so important. The second thing I think that we can do is just what we always do when it comes to advocating, which is just to do the person-to-person contact of legislators and elected leaders that needs to happen for people to have this front and center. Not only, you know, people like me, although, you know, you can call me if you want to, but I know, but also their staffs and the people that are working with them, because the level of the, you know, influence and power of staff, especially at the congressional level, is really significant. And so reaching out to those folks as well is really important. And even though we're not there physically, we are all still here virtually. So raising up this issue, I mean, wouldn't it be incredible if, as we were doing a so-called COVID-4 response package, that we could include reauthorization of the Violence Against Women Act in that piece of legislation? I mean, every day people in Congress like me are looking for ways to advance really important national priorities at the same time that we are addressing our response to the coronavirus. And so that is just a question of advocacy and keeping the issue hot on people's minds.
One thing we can commit to for everyone on the call, and we can make sure we get it right with our partners from Reliance, is communicating to everybody who's been on this call the list of senators who have not yet supported or signed on to support the reauthorization. And I think it's helpful to know it is something that most senators will have on their websites, but it's not always easy to figure that out. So I think that's something we can commit to do, so that you can figure out if your own senator has signed on.
That's great.
And then I know I have to leave us soon, Senator Smith, so I'll ask you just one last one. You know, President Trump talked about he's tweeting about liberating some states, you know, suggesting that parts of the country need to reopen and the economy needs to get back to work soon. You mentioned the importance and the value of staying at home right now for folks. I guess, what would you say about Minnesota's efforts to stay at home in quarantine? And do you think that your state is going to be ready to reopen anytime soon safely? And folks getting back to work and some semblance of normal life.
I'm really angry about this today. Minnesota has done the right things, like many states around the country, but not all states around the country, to mitigate the spread of this virus. And as a result, we are seeing a slowing in the growth of the virus, and the incidence per capita of coronavirus in Minnesota is a quarter of what it is in Iowa. It is a quarter of what it is in South Dakota, states, for example, that have not done the stay-at-home order. And the way that this works is that we are all in this together. We all work on this together. It is not about dividing us. It is about understanding that my health is affected by your health, and your health is affected by my health. Yet today, in front of the residence of the governor of Minnesota, there is a protest with people wearing Make America Great hats again, congregating, shaking hands with one another, fueled on by the president saying, "Liberate Minnesota." And it is disreputable, and it is so irresponsible. I feel confident that if we listen to the public health experts, if we understand that in Minnesota, roughly 80% of people working in this state have jobs that allow them to continue working. So the economy continues, and we can learn from that. And yet 1 in 5 people in Minnesota right now have lost their job in the last month, a dramatic reversal of people's economic stability. And this is not a moment where we should be trying to make a political point. It is a moment where we should be trying to come together. So the president's, I'm almost speechless. And I just want to urge people as I get off the phone that, I mean, this is an incredibly difficult time. But thank you for what you are all doing in your ways to help keep yourselves and your family safe. And if you are a nurse or a emergency physician, or you work at a checkout stand at a grocery store, or you drive a truck, thank you. And just know that I'm doing everything I can to make sure that you can be safe in your job while you're doing work to keep us safe.
Well, Senator Smith, thank you so much for all that you are doing. Thank you so much for taking the time to join this very important conversation today. Please stay safe and stay healthy.
Thank you, Senator. We're so grateful for your continued support. We really appreciate it.
Thank you so much. Take care, everyone. Be safe.
Thank you.
Thank you.
So we have a few more minutes to keep our panel going until we need to wrap, and we'll sit back to you, Erin.
I think we have a few more minutes, and I want to talk about an issue that I've heard in doing my reporting. We know that people are, who are already kind of stretched thin in their day-to-day lives, maybe stretched to a breaking point at a time like this. And, the issue of, possible new domestic violence cases is something that I want to ask both Paige and Ebony about. I mean, if a lot of us are very fortunate in that we are happy, healthy, well-resourced, privileged people, who are staying at home with kids who have access to the internet and can be on their laptops. But, when you take people who maybe were furloughed, maybe you don't have all those devices or access to the internet, who aren't getting their groceries delivered online, I mean, it's just increasingly stressful and a recipe for tension and conflict. And so, Paige, can you talk about how we may be seeing domestic violence becoming a new thing for folks in this pandemic, and what folks need to have in mind and to look for around both physical or emotional abuse at this time?
Yeah, this kind of close quarters does not always breed wonderful things in a relationship that might be tense. And if you add on top of it the presence of the kids and the stress of the children in the home, and then, you see the stories about alcohol sales being up so much, and then the fact that how many gun sales have gone up, that also really terrified me when I read about that. So encouraging people to be aware and recognize the tension that's in the family, and then to really have a plan. I mean, that's what's so great about the Family Place Hotline or the National Domestic Violence Hotline. They can help work through a safety plan, because safety plans are like fire drills. You know, we practice where we're going to go, what we're going to do when something bad happens, when there is a fire. And so those are the same things safety plan can help you with. But you have to sense the tension in the home and be aware of where you shouldn't be in the home, whether it's in the kitchen or in where there's knives and other types of things that can be used as a weapon, or the bathrooms, which are small and you can be locked in. It's hard to escape from. We talk to people about having a relationship with your neighbor that you'd actually share that you're concerned about your safety, and that there might be a code word or a sign that would say, I need help. If I can't call 911, maybe someone can call 911 on my behalf. One of the things I think that you are seeing is more calls from people that are concerned about the neighbors they hear fighting. And so there's that piece of it that is, I think, what some of the more hotline calls are happening is I hear these people screaming next door, what should I do? And so we should continue to call or ring the doorbell or do something that might interrupt a situation. We tell people to just get outside, run out your front door. It's okay to just get out of that situation and take a walk, go get away from it. But even people of privilege, even people who have all the resources they need can find this happening. And again, letting everyone know no one deserves to be hurt. And it doesn't, all these services are free and confidential for a reason. Even if you could pay for them, that's okay. And encouraging people that they matter and to give those hotline numbers out. Those are things that we can all do for each other and for friends, and checking in too. Checking in on each other is really something that's would be so valuable.
Paige, you raised a really good and important point there. And I want to end this with one last question from Samantha Gildy. And pardon me, Samantha, if I'm butchering your last name, I apologize. She says, good afternoon. I'm a 20-year-old college student tuning in from Oregon. My university, like so many others, has been closed due to COVID-19. Aside from pointing people to resources, what do you recommend that us students as young adults can do for each other at the university level to support fellow students going home to unsafe situations? For example, should we write to our university as we would to legislators? Should we reach out to organizations to lead seminars such as this for students? How can we advocate for each other? A really good question.
Oh, that is a really good question. I would encourage friends to check on friends. I think that's the most important thing you can do, is to constantly stay in contact, and don't be upset if they don't communicate back for a while, because sometimes people are too ashamed to talk about it. The main thing is just asking the question, are you okay? Are you going to be safe when you go home? Especially if they've shared with you that there was something not right in their home. But if you have an inkling, if your gut instinct tells you that that person's not safe, it's okay to say, you mean so much to me. You've withdrawn. I'm concerned. We're not going to see each other for a while. Can we talk about how things are going to be when you get home? Sometimes people have never asked the question. The woman has walked into her office 10 times with a black eye. No one said a word because they thought it wasn't their place. It is all of our places to step in and to say, I care about you. You are important. How can I help? And so to that student, I would say, find the resources online. There are plenty of them. We have one called B Project at the Family Place, which is targeted to youth. Becky's Fund is another great one that's based, I think, in New York, that has resources for you to talk to your friends. And then do it. Don't be afraid to do it.
Yeah. Well, I think that's a good note to end on. I'm going to pass it back to Lauren, but not before just encouraging everyone again. I learned a lot from this conversation, and frankly got a lot of story ideas that I will be pursuing and publishing in the 19th News. So if you are not yet subscribed to our newsletter, you can do that by going to 19thnews.org/subscribe. And if you are already a subscriber or a donor, thank you so much for reading. And Lauren, thank you so much for asking us to participate in this. It's been a very valuable conversation.
Powerful conversation. And we'll be sharing all of the resources that have been mentioned on this call, including the hotline numbers and the subscription to the 19th. We will be sending those all out. I want to just take a second to thank so much our panel, our amazing, incredible panel. I got to say, I'm so humbled every day when I get to hear from women like you who are doing such incredible work, Ebony and Paige. It's really a privilege. So in the last couple minutes, I'm going to just go back to our slides because I do want to just share a couple parting thoughts. And we got some great Q&A, but I want to just share a few parting thoughts about what to do. And obviously, Ebony, I'll also give you a chance if you want to jump in with any more additional guidance on advocacy before we wrap. We will definitely end on time, but just really briefly, as a recap, contact your representatives. Either at the state or the federal. And I think, you know, normally we are very focused on the state level advocacy. I think when it comes to COVID right now, the advocacy at the federal level is very, very important, especially because of these large scale federal bills that are getting passed. And we need to make sure that those bills take into consideration these critical and essential issues. So I think now, you know, we often talk with folks about thinking about urgency, and I would just suggest that it is urgent right now, and it is not always, but because Congress is looking right now at the next package of legislation, there is an urgency, and I would suggest if you can make 5 minutes, send a letter, make a phone call to your member of Congress and your senators this week, well, it's Friday, but within the next few days, if you can, to make sure that you are voicing your concerns about these issues. If you are interested in supercharging your advocacy and learning more, we welcome you to join the All In Together Emerging Leaders program. It's a part-time virtual program always, and it enables you to go deeper on your civic advocacy. We have ongoing leadership training. And Erin has already promoted the 19th News. I will again. We will be sending you the links to register, and I really encourage you to follow critical news sources like this. You know, what's so powerful about these news sources like the 19th that are focused on gender, and there really aren't many, is that it helps you get a deeper understanding of these issues because women like Erin are covering them. And a lot of the mainstream news just doesn't cover these issues in as much depth. So Ebony, I wanted to give you 1 minute. We have 2 minutes before we wrap. Is there anything else that you'd like to share about the call to action on the advocacy? And then we will wrap right on time.
Yeah, just very quickly, there is a lot of information out right now. I've shared some obviously with Lauren and the group at All In Together about what specifically is being asked for to help provide better services to survivors. That includes folks who are part of marginalized populations, Native survivors, immigrant survivors, what exactly the funding sources are for. There is a significant amount of funds being asked for sexual assault services, for transitional housing, for survivors, specific to funding specific to tribes. So there is some really, really good information out there about that and can hopefully drive your advocacy. Also, as Lauren mentioned, the district advocacy toolkit before, there is some more information if you want to make a direct connection that you would have through district advocacy and scheduling remote visits. And so you can find that information that we shared as well and how to do that fairly easily. But thank you so much. This has been amazing. And we really
fabulous. Thank you all so much. And thank you to the many, many folks who've joined us. We really encourage you to follow us. We continue to put out resources all the time on these issues and more. Please do follow us and stay connected. This whole program will also be posted. It's been recorded, posted on the All In Together website. We'll be sharing it back out on socials. So please share it with those who weren't free to join us at this time. And I just wanted to thank every one of you for taking this time to think about supporting women who may not be able to speak up for themselves. We need you. We need each other. Little did we know when we chose the name All In Together, how truly all in together we would be in this time. And with that, I just want to say a huge thanks to our speakers, to Erin, to Paige, and of course, amazing Tina Smith, who took time out of her insanely busy day. So thank you all so much. Be well.
Happy to be here. Thank you.
Thank you.
Stay safe and healthy. Have a good weekend, everyone.
Thank you. Bye.
Thank you.